quick rundown here. So what you're going to do with some of these is make sure to move around the patient. Before you even line up the tube or anything, one of the things you always want to do is make sure your patient can get into the position, check your positioning lines, but also work around the patient. One thing I mentioned with the last group was that if you stand over here, maybe I can see the positioning lines from over here once I start getting her lined up, but I can't see the mid-sagittal plane, which means I can't check for tilt or rotation, okay? The only way I'm going to be able to do that is if I step around behind the patient and look at them from the back of the head, or if you're doing an AP, to look at the front of their face, okay? And see where that mid-sagittal plane is, okay? So one of the things, if I'm back there, you know, I'm not standing like that, obviously, but I'm usually back there watching when you're doing your comp. When a person doesn't move around their patient and they say, oh, everything's straight, they go beep, and when I come over and check and there's definitely tilt or rotation, they're always like, oh, but neighbors, I checked. No, you didn't. I didn't see you move around the patient. And I already know at that point there's going to be tilt and rotation. If you never move around the patient and you never check for it, nobody sits perfectly straight. Nobody, okay? It's just not natural for people to sit perfectly straight. So unless you check for it, there's going to be tilt and rotation, okay? So scoot up nice and straight there, get back closer, there you go. All right, and you're going to place your nose and your forehead up against the IR. There you go, and oops, sorry. This needs to come out of the way so I can see where, oh. There we go. All right, so nose and forehead. So for her, I'm looking for the corner of her eye back to her ear. And it looks like it lines up nicely. So again, that's two patients we've had, you and now her, that line up well, at least for the OML, when they touch their nose and their forehead. Okay, not everybody's gonna do that. There's a lot of people in here who won't, for one reason or another, okay? So if we're doing a Caldwell, which is the one we're gonna start with, you need a 15-degree tube angle. Yep, watch out there. All right. I'll leave it wide open like that. Now you can see there's obviously rotation here, and it looks like a little bit of tilt that way too. So I need to straighten that out, and then we'll do some final adjustments for where I think the central ray and the collimation and all that stuff. Get you nice and straight here.
I can't see shit.
There we go.
That doesn't feel straight at all.
I know, it's because you're not not used to actually sitting straight. Everybody sits kind of crooked, so when you straighten them out, they're like, that doesn't feel natural. Well, of course not.
Balancing on your nose.
Yeah, nobody's ever perfectly straight. There we go. All right. You do like to rotate. You're different though. You like rotating to the right. She likes doing everything to the left. She was tilted to the left the whole time. All right, so let's start collimating here. So what needs to happen is I need to make sure I got the top of her head, both sides. I might need to get over that way in a second. But I also need to make sure that I have the base of her skull. And the base of the skull is, of course, going to be the mastoid tip. And you can see if I'm right on the mastoid tip here, I have plenty of light down here below. That's why I say you need a straight edge of some kind, okay? The other thing, rotating on me.
Oh, you're picking.
So, you have to have a straight edge. You can also check where your central ray is. Remember I told you even though the patient is facing toward the IR, you can still check where your central ray is. Here is where my central ray is. There's her nasion. So I can tell where the central ray is. So for her, yeah, it's pretty close. I think I'm going to cheat up just a teeny bit. Collimate down a little bit, side to side. So we might be just slightly above her nasion. Really love rotating on me. She said she rotates to the left because she's, you know, a lefty or leftist. You must be a conservative because you keep turning to the right.
He said it was liberal.
Same thing. All right, there you go. Cool. Okay? So there you are. All right. Again, light field above the top of her head. You can see that's just hair, okay? To the ears is what I like to go kind of on the side, maybe a little bit more. And then, of course, you can obviously see I have the mastoid tips on there. Okay? So that's what you're going to want to look for, okay? That shows me that I have all four, right? Top, bottom, and both sides. All right, relax for a second.
Ooh.
Yeah, I know.
Sort of sit still.
Yeah,
Oh.
there you go. Let's see, what do I want to do for the next one? Yeah, I guess we'll just do the PA. Alright. Now, one of the things you'll notice is that the light field changes once you angle your tube. I'm going to lean you off to the side just for a second, just so I can kind of get my collimation back.
Here's that screw.
Come up here just a little bit. There you go. Alright, so we're going to start from there and we'll see where we're going to go. So same position, you're just kind of, there you go. I kind of like you to scoot in just a little bit. You don't have to move the chair, just slide forward on the chair a little bit. There you go. Alright. Alright. Just like that. Same idea. I'm going to open this up so you can see where we are. Here's the mastoid tips. So I can definitely go up and then collimate. Right? Because if I collimate now, I'm going to start clipping the top of her head. So we're going to come up just a little bit. Make sure we still have that on there. Yeah, we do, easily enough. And that, like I said, is just hair. So we definitely have the top of her head on there. No problem. Collimate side to side. And then don't forget to adjust your bucket coming up just a little bit. Alright. There you go. Hey, you're doing better now. Alrighty. Okay. Check this too if you want. There it is. OML. Pow. Alright.
You have almost like an inch underneath, right?
Where?
Half an inch.
Yeah, I don't think it's an inch. That's not an inch.
No, underneath.
Yeah,
Underneath the ears.
maybe.
Oh, -5.
Maybe. Yeah, it's still a good combination. So, I used to collimate more than that, and then everybody got mad at me. Nobody collimates out of the clinical. Tell neighbors not to collimate so much. So, yeah, complain. So, I give you guys a little more room now. A little more. Just don't not collimate at all. All right, relax. Lean to the side.
Why don't you do reverse
That still is smaller than a 10 by.
Task method?
I'm going to do Haas. I don't want to do it now. I want to finish my cranial series. Mm-hmm. Alright, it's like I've never done this before. Go that way. Go. Alright, turn this way. You're going to turn 45 degrees. Like I said, you want the person to sit up nice and straight. Turn 45 degrees. Kind of turn your shoulders though. And what's going to happen is if you tell your patient to put their face up against the IR, they're going to be very rotated and tilted. Because when they put their face up there, they're going to do this. Okay, and when they put their face there, that's going to have them really well out of position. So what you want to tell your patient is to balance on their ear. If they balance on their ear, it's going to be fairly close. Yeah, you're fairly close to a lateral. It's not perfect, but it's pretty close. So it's only going to take a little bit of adjustment to figure out, how to get you in a true lateral. Okay? Relax just for a second. There's one more thing we got to do. Guess what we got to do?
Landscape.
Ah, very nice. Let's do this. I think your head's very tall, so. So we'll see. All right. So there we go. Balance on your ear. Now, try not to hunch down. So I'm gonna get you to sit up a little. There we go. All right. So if you come. So I gotta come this way, look straight at her face, and I can figure out if she's tilted or rotated. She's actually rotated a little bit. So what I'll do is rotate you out this way just a little bit. Trap your chin just a teeny bit. Just right about there. Okay, just like that right there. Look straight ahead. There's the IPL. Right? Exactly. So there you go. All right, so I am gonna down just a teeny bit. Now, what I want, see, I'm going to collimate this way here and there. If I clip off the tip of her nose, it doesn't matter, right? What I need is the whole cranium, top and back, and then again, mastoid tips, okay? I definitely have light field below the mastoids. If I have light field below the mastoids, it means I've got the base of the skull. So don't forget to check for that, okay? Come down just a teeny bit. Hopefully your shoulder's not under there. A little bit, huh? Good. Slide your back. Just a little bit. Yep, definitely on the back of your skull there. Got the top. Just need to make sure you're not tilted or rotated. Alright, straight ahead. There's the IPO. There's the mid-sagittal plane. Alright, there you go. Alright, that's our lateral. Cool. Alright, you relax. I know, good fun, right? Yeah, alright.
I'll pick me as a patient.
Yeah,
My neck.
yeah, you're not bad, you're doing good. Alright, let me lean back here. So I'm going to change this back to this again. Now what you're going to notice is even if I set this here, right, as a 10 by 12, what people forget is when they angle the tube, that's going to change. Okay, so I've seen people like, oh, I collimated neighbors, I did this, I did that. Now check this out. When you turn this, we'll assume that you're going to do 30 degrees. Look how much different that is. It's huge. Now it's almost the whole thing. It's almost a 14 by 17 at this point. Okay? So remember that when you angle your tube, you're going to have to recollimate. Okay? Get down to like a true 10 by there. Okay? So, and then of course, we'll go from there and kind of figure out. Now before I get her into this position and do all this kind of stuff, I want to see what she's going to be able to do. Is she going to be able to line up the OML or not? Or am I going to use the IOML? And then I'll know for sure if I'm going to use 30 degrees or 37 degrees. So I kind of want to test all that stuff first. All right, spin that way for me. You're going to spin outward. There you go. All right, I'm going to bring this down some because I know we're going to need that. All right, so you're going to place the back of your skull up against the IR, but now you're going to have to tuck your chin all the way down. I know, right? Yeah, this is the no fun. Look at me. Yeah, there you go.
Normally you take the hair tie out, right?
Yeah, you normally would, but there we go. I think we're gonna get this just fine. Okay, let's see here. Now what I'm looking for is the corner of her eye. Back, tuck the chin. Yeah, it's pretty close. You know what? I'm gonna try not to decay it. Go ahead and lift your chin just a little bit more. I'm going to do the IOML. So I'm coming right from underneath her eye, straight back. Lift your chin just slightly more. There you go. There you go. That's going to be the IOML. So now I'm going to need a 37-degree angle on there. Fortunately, she's not super tall. It's hardest with like guys who are tall. When they're sitting up really tall, and you also have to use the IOML, you're going to run out of space here. It'll go up high enough that sometimes you're forced to move them to the table because you just don't have enough height. Okay, and you can lean them out a little bit, like I could have done this. Scoot out just a little bit. There you go. Drop your chin. Right, I bet you'll probably be able to get it this time now. There you go. Yep, there's the OML. So if I lean you back a little bit, you can get that position. And sometimes laying them on the table also helps, right? Because you can put like a positioning sponge or something. Just make sure you use the small positioning sponge. Don't use some big like 45-degree angles positioning sponge. That's too much. Going to create a lot of OID like that. Actually, you know what? Since you think you can get that, I think I'm just going to leave you and do it at 30 degrees. Get you straightened out there. All right. Come down. Aw. This is.
Manhandling.
It's actually probably a little bit stripped because you guys do manhandling.
Because it's things from like World War I.
What's that? Oh, wow. All right, now one of the things you'll notice is I actually have light field behind her head. From your perspective, somebody hit that light back there. From your perspective, it might look like I'm clipping, but if you get a little closer here, you can actually see, I actually have a light field behind her head, right? That's actually all of the top of her head on there. So, and look at this. You got tons of light field down here. So I can actually cheat up and collimate just a little bit more. Alright, let's collimate some. I still have these mastoids on there. Come back down just a teeny bit. There you go. Definitely have the mastoids on there. Definitely have the top of her head on there. So all I gotta do now is collimate side to side. So, make sure I'm gonna bring this up just a teeny bit. Collimate side to side. Collimate more than that.
Oh my lord.
Really never.
Collimation, yo.
You can get paid more, so.
Wow. Well, if you do it right, you get paid at all, right? Oh, and there's the OML lined up. All right, very nice. There's your town's view. Who runs this town? I think it's neighbors. That's right.
Alright, so that's the series.
All right, so there you go. There's the series.
Stop it.
We have
Now
two
start
views,
over.
and then we'll let you go. How about that?
Okay.
You get to break free.